What actually happens when a dentist places a dental implant? Are they really drilling a metal screw into your jaw? Millions of Americans lose teeth every year, but many people don't understand how modern dental implants actually work. This 3D medical animation takes you inside the procedure. First, the dentist examines your jaw using digital scans and X-rays. The goal is simple. Make sure there is enough healthy bone to support the implant. If there isn't enough bone, some patients may need bone grafting before treatment. Now the procedure begins. After the area becomes numb, the dentist carefully creates a small opening in the gum. Then, a special dental drill prepares the bone. This step is extremely precise. Next comes the implant. A titanium post is placed into the jawbone. Titanium is widely used because the human body usually accepts it very well. But here is the amazing part. The implant doesn't simply sit inside the bone. Over time, your jawbone actually grows around the implant. This process is called osseointegration. It can take several weeks or months. Once healing is complete, a connector piece called an abutment is attached. Then the final crown is placed on top. The result looks and functions much like a natural tooth. Modern dental implants can help restore chewing, speaking, and smiling. And for many patients in the United States, implants have become a long-term solution for missing teeth. Subscribe for more 3D medical animations, dental procedures, oral surgery, and human body science.